Hello everyone, I'm here to start case number 1 of our 100 important cases series. It is called as Paraphimosis in dogs. Please subscribe, like and comment to our YouTube channel. What is Paraphimosis? So, without delay, we start our video. Paraphimosis is the inability to completely reduce the penis into the perpetual cavity. You can see that the penis is fully erected and the poor dog is unable to retract its penis back. It is very painful condition. Here you can see the penis which is fully erected. Now we will discuss the causes. Major cause: the skin at the perpetual orifice becomes inverted, trapping the extruded penis and impairing the venous drainage. Other causes Other causes of paramyphosis include a small perpetual opening, priapism, foreign object around the penis, a constricting band of hair at the perpetual orifice, or trauma. Differential diagnosis is: number 1, priapism, which is persistent erection without sexual stimulation. Number 2, a congenitality short prepuce with secondary penile exposure, penile neoplasia, etc. Priapism shown in the picture. Complication if left untreated. Number 1, paramyphosis warrants veterinary intervention if not resolved quickly. The exposed penis quickly becomes edematous because its venous drainage is compromised. Complication. Number 3, with continued exposure, the mucosa becomes dry and painful. Self-trauma exacerbate the condition. If we talk about the treatment options, if paramyphosis is caused by the hair at the tip of the prepuce, you can do what I did and gently pull back his shaft to release the hair from his gland. In certain cases, veterinarians say you can reach for some coconut oil, apply it to your dog's penis, and try to gently reposition the gland back inside the sheath. A cold water compress may be applied. Surgery is the last option. If your dog experiences paramyphosis for an extended period of time and you cannot get the penis to retract, then go to your veterinarian immediately. More serious cases may actually require surgery. Condition after surgery: it was a successful case. Thanks for watching.